Hello, everyone, and welcome to VIES Healthcare's webinar, Follow the Money from Your Purchase Services Line Item Details. I'm going to put the presentation on the board here. I am Lisa Miller. I am one of the lead healthcare consultants, CEO. I have Rich Dormer here, who's also a healthcare consultant and COO, and Brian Colbert, who is a senior healthcare analyst and consultant with VIES. So welcome. We're going to get right into the webinar. We have a lot of information to share with everyone. We will get a follow-up. We have a booklet follow-up. We will get that. Everyone who attended will get that booklet. So let's begin. Just real quick, a little context of who we are for those of you who may not know. We are VIES Healthcare. We've been working with hospitals for over 18 years, specifically in non-labor expense reduction, all different kinds of cost analysis. So we work in all different functions, whether it's a large initiatives, IT, OR, supply chain data analytics. So that's just a 30,000-foot view of us. If you'd like more information, you can email me after the webinar. As everyone knows, today's webinar is about purchase services line item details, and really the optics into purchase services spend. And we're going to cover a whole host of challenges, problems, and some case studies that really will shed some light on how to gain visibility and how to analyze purchase services line item details. So the 30,000-foot view, purchase services is 40 to 50% of a hospital's non-labor spend. It is a manual invoice-to-contract reconciliation. We'll talk more about that during the webinar. Those invoiced line item details are not available in a hospital's materials management systems. They have complex agreement structures, so there's lots of different moving parts and different tiers, and the areas within purchase services spend require a lot of specialization to review, to understand, and really, in many cases, even negotiate. So how do we get to the line item details? There are three ways that you can get to the line item details. One is you go to AP. You copy invoices, or you pull them down if you've got them scanned into your system, but you pull down your invoices and you manually put the data into an Excel spreadsheet. And we would do that for years. That's kind of what our process was for years. So we have first-line expertise into kind of getting those invoices, typing them into Excel, and getting the data that way. The second is you can ask your vendor for your utilization, right? Our experience is that this data is not always accurate. Plus the invoice line item details like surcharges and fees are not included in the reports, and a lot of that is so key to purchase services analytics. And three is to automate the line item reconciliation of your purchase services invoice to your agreements and have a way to have monthly line item spend analytics, and we're going to show you that today. So a little bit of information about how we work and how we have a proven process. And our process is ROI. It's reconciliation, optimization, and intelligence, right? And we're going to talk a little bit about this in more detail and give you examples. But before we get into this, there are a number of different ways to get optics into your AP spend, right? There's a couple of companies that offer that categorization of spend, right? And basically that takes 3 to 4 hours to kind of categorize your AP spend. And while that's directional, it is just the tip of the iceberg. It is, you can get your AP spend, you can categorize it and get it every month and look for, look at your spend as high-level category information. However, in our experience, there's also some problems with looking at just categorization of data. And we'll talk about that for a minute, in a few moments. But we're going to begin to really hone in on getting contracts, getting those line item details, and looking at how do you reconcile, how do you optimize, and then later, how do you gain intelligence?
So again, back to the first step is really what is the targets? And when you categorize the different areas, it's looking at where are those buckets, where do you want to really focus your resources and your energy. And it's important, but really when you decide on, okay, well, we're gonna tackle dietary, we're going to tackle debt collections, then that's the time when you start to really roll up your sleeves and what we say the real work begins.
So talk a little bit more about our proven ROI process. It's built on 18 years of frontline expertise, right? So we're always going to look at, a year, 2 years of data. And again, it's invoice data that we look at. So is it on off-contract spend? We're verifying on-contract spend. We're looking at rebates, credits, or incentives in the agreements. Then we're looking at what are the line item trends telling us, right? Is there variations, excessive fees, or there standardization opportunities? And then we go into intelligence, and that's, do you have market competitive rates? Do you have best-in-class rates? Are there other ways to put together an agreement? But a lot of people go right to, well, let's benchmark, and we say it's obviously very important to benchmark, but there's huge amounts of opportunities that are missed if you're not going to go back and look at a year, 2 years worth of line item data, because that information is going to tell you a lot about utilization. It's going to tell you have you missed opportunities from your contract.
Right, and just a parallel, if you're going to go out to RFP on, let's say, laundry and linen services, you can go right to the cost per pound and put that out to bid. But to be the most effective and understand really where all the costs are, you're going to do an assessment. You're going to go through, you're going to go to each of the departments, you're going to go to each of the facilities, you're actually going to visit your current provider and understand how the operational system works, where are the holes, where are the gaps, what are the service issues, and then making sure that your RFP is geared towards, fixing those problems. And not only that, but identifying where the cost drivers are, because it's not always cost per pound. And that's the same with our process. It's not, the intelligence is there. Yes, cost per pound, where are you now, where you should be, but the reconciliation, the optimization is really going to drive the cost savings out of each of these initiatives.
So we always speak in terms of 6 major categories for purchase services spend: clinical, facility support, finance, HR, HIM, biomed service maintenance, telecom, and admin nursing. So this is just some context, 30,000-foot view.
Right, and we've had with our clients through the years, they go, well, we feel like this category, we should be in this category. At the end of the day, we're just trying to bracket these into different areas. I mean, you could really make a case that telecom and technology is really in every one of the categories. So there's arguments from every way, but we do it this way, and it's worked with us and our clients. And
we're flexible if somebody likes to kind of move things here or there. But for the most part, these are the major categories that we've been successful in bucketing, throughout the years. These are high-value areas of cost savings opportunities. Not everybody will have wound care dialysis, but certainly, you'll see some areas like, of course, telecom, merchant card services, TV rental, coding. So, these are some great opportunities for purchase services cost savings, and they are also areas that are very challenging to reconcile your monthly invoices to agreements. Very difficult to get the variations and understand what's going on. So while they're great opportunities, the opportunities lie in what are your ability to get spend data analytics for purchase services. And we'll move right into some of the challenges in line item detail analysis. Number one is you could have, there are hundreds to thousands of line items to review each month. It could even be by vendor, it's hundreds to thousands of line items to review. And in some cases, and we're seeing a lot more of this, unfortunately, we're seeing summary invoices, which that's just incredibly problematic because there's no details behind the invoices. And what makes purchase services different and more challenging is that unlike your traditional stock items or items where you'll buy them You have a PO, you buy them, they deliver, you check them in. Services are performed and then invoiced, right? So that's a major shift in how the invoicing happens, right? So there's got to be a tremendous amount of trust. We always say trust but verify. And the major purchase service challenge we see is that the complexity of the charges and how they're invoiced, and there's a high billing error rate. And just we see so many times that those invoices have a lot of errors, and they usually get overlooked because these invoices come in and the invoices are plus or minus 10% of last month, and they look okay and they get approved. It's only when there's like a big spike in that invoice that someone says, okay, let's dive in to see what the problem is. So invoice line item details that are almost impossible to reconcile every month. I'm going to go through a bunch of examples, but things that everyone on this webinar have experienced or seen, right? Lots of examples, so bear with us, but I think it's really important, right? So your line item details are trapped in the invoices. So you see container fees, admin fees, environmental fees, fuel charge, regulatory fee, trip service fees. And yes, they're $21, $28, $16, but as you'll see, all of these purchase services invoices have these different, minute, details that probably shouldn't have been on the contract. B, they're at the wrong price added, but they add excessively, to the cost of services. Again, these are all trapped into the invoices. They're not in your materials management system, so you can't analyze them. They won't. Red flag, minimum service charge orders, refile fees. It's a little bit blurry, but I thought it was important. These are those specialty reference testing. We're seeing a lot of those specialty reference lab testing, esoteric testing. Are very expensive, and we're going to talk a little bit about revenue insurance, as it relates to purchase services. But again, these details are in the invoices. So when these invoices come into the hospital, they get put into the system as a total invoice amount. So you don't get to see the details that you're seeing on the page right here. But this is dialysis, 1-to-1, 2-on-1 rates, but here you have TPA administrative fees, you have, cartridge fees, non-routine hour fees, after-hour call-outs, delivery charges. For delivery, you look at, mileage is 0 to 17, 18 to 50, 51 to 100. Wouldn't it be great if you had a report that showed the mileage that every month that you said, okay, wait a minute, I want to pull out a report that shows the mileages by category, instead of having to look at it, maybe do a quick calculation on the paper, have to hand put it into Excel, to actually see, well, wait a minute, are we spending more on 51 to 100 miles, or are we spending more over 100 miles? This is really interesting because this is an invoice with the 2 items, right, both the same and different pricing. Forks, Jell-O, same thing, different pricing. We have, again, we're going to go through this, and then we're going to get to some more interesting things, but I think everyone understands the value of all these different line items that are, kind of trapped in those on invoices. And so what we want to talk about today, and also show you some specific case examples and how you can look at your purchase services analytics, is how we've innovated the management of outsourced purchase services. So we have the ability to digitally extract line item details, right? So invoices come to us, we digitally extract those details, and within seconds, so we're able to reconcile, optimize, and then perform intelligence. So these are complex invoices, and within seconds now we have them, in an Excel database, and then we're able to analyze after. So we're able to identify pricing discrepancies as they happen. If you notice here, September 30th, you've got milk at 2 different prices, and normally this is an invoice that would be, one of like 500. And so we're able to extract those details, and you'll see some pretty cool spend data analytics. So the power of invoice line item details, why is it important? Department directors, in some cases even CNOs, are actually reconciling, spend invoices to contracts, and that's a very expensive way to reconcile invoices, and very inefficient too. The identifications that are services that are outside of the main fees that are costing you money, and in our experience, we're seeing that 20 to 30% of those costs are outside of what you think you're spending, or they're excessive fees or other additional costs. And then organizational trends for utilization improvement. Aim where the player is running, not where you are now. And what we're seeing is there's a tremendous opportunity for purchase services cost reduction, but if you tie that into utilization, it really becomes a significant opportunity to look at utilization opportunities. And the ability to take data and to confirm with revenue cycle that items are being charged correctly. So again, we're going to go back to it's one of 3 ways that you can get line item details. You can ask the vendor, right? So they're not going to show you shipping fees, late fees, pickup fees. They're just going to kind of give you those key areas, right? And sometimes you don't see pricing variances, and sometimes they don't give you all the data. Copy invoices, input yourself. We've had hospitals that just hire FTEs to put in the data. It's very labor intensive. And we're going to talk about VIES invoice ROI systems. We've kind of cracked the code. We're patent pending, and we're able to extract those line item details from invoices. We build a database with your contract, and within seconds we can reconcile your invoices to your contract in place, and then trend line item details. And it's really very, very powerful. In the best practice that organizations, successful initiatives get to line item details, right? So you understand discrepancies, you get credits, you see trends, and you're able to negotiate the best deal. Not just driving to intelligence or benchmarking. All of the things that lead up get you the best deal when you're able to really have all this data. But then the pricing issues begin once that agreement is executed, because once it's executed and you've gotten the best deal, you want to be able to manage that every month, right? So we call it the life cycle management of purchase services. So it's not just the front end, but it's also the ongoing management. And tracking the performance of a completed initiative, and identifying issues, discrepancies, variations as they occur, not 2 or 3 years later when the agreement comes up and now the team starts this whole process all over again. So we're going to show you some really cool things now. We're able to identify purchase service billing errors versus contract pricing before they're paid. Items that are not on contract immediately, utilization improvements, service issues, and see trends as they're occurring, not 2 or 3 years later. So it minimizes the need for kind of these performance improvement initiatives or AP audits. Gives you great ability to have line item detail reports generated, and you're better prepared than the vendors for business reviews, and then the ability to actually tie in and validate crosswalk purchase services, like clinical purchase services like dialysis and esoteric testing, and be able to send these reports to RevCycle to say, listen, we just want to make sure and kind of validate and audit that these charges are actually in the system, and that can be done now at a push of a button. So we're going to go through some examples: clinical support, medical necessity, denial management, telecom, agency staffing, biomed, pathology, medical gases. Even though it's purchase services, we are going to show you some really cool things as it relates to physician preference items. We often say that even that category acts also like a service because they're such service related. And so we're going to show you some powerful analytics there as well. So I'm going to hand this over to Rich and Brian. We are going to share the screen, and Here, they will begin now.
Great. Thank you, Lisa. And the first example, I'm going to try to fit this on the screen here, but this was a contract we were reviewing for our client. It's a physician decision support agreement, highly sensitive drug information for physicians at their fingertips. And this is a 3-year contract bundled agreement for a large health system. So what I want to highlight here is that, obviously this is benchmarking. You come in, understand where the costs are, benchmark within our proprietary database that we use from clients throughout the country, and determine what the price is for this hospital, leverage what we can, and move forward. But again, back to our point of this webinar is let's go to the invoices. So it was interesting, as soon as we asked for the invoices, we looked for 12 months worth of invoices. This invoice was going to be paid, and you can see that it's in the 3 years. It's actually the 3rd year with outstanding balance. All right, so this was a separate invoice to the initial renewal of this main bundled agreement. But what we saw here was the neofax drug information. And as you can see here, standard neofax drug information and standard pediatric drug information was part of this one single suite. When we brought it back to this vendor, and some of you probably can identify them, but we're blocking out the vendor name so we don't get yelled at. When we went back to the vendor and requested the confirmation, they determined that yes, indeed, this was a duplicate billing. So we were able to stop this payment as well as get the credit back into the bundle because this was a 3-year renewal. So again, back to what we're talking about, which is really important, is even though this is really a quick high level, all right, well, we know where the fees are, this is a bundled agreement, we can compare this, and we understand where the market is. We always want to say, all right, let's make sure that we're not missing anything. Let's make sure that there's nothing in the invoices, because again, like the webinar says, follow the money. If you're not getting paid, it's going to come through the invoices. So we always want to map them out. This one's really easy because, there's only a handful of invoices. We're going to get a little bit more complicated now. So that's our first example. Second example, and don't mind me while I try to find it here. This is, and again, we kind of had to block some of these out. Some of them had some PHI information, some of the vendor information, some of the hospital information. So we're kind of just putting it in high level. So this was in a finance. Now this is medical necessity. So there's an outsource agreement. Company is based on cases per month and has a certain cost per case. And when we first were provided the information, we went back and got 12 months worth of invoices, inputted that into, and extracted it into an annual. So they were at a 3,000, amount 6 hospital health system with 3,042 annual cases, which is a pretty healthy volume. If anyone knows this company that I'm talking about. And, their costs per month, $254, which is very, very healthy. And in their contract, they have a $205 minimum as far as how many cases per month. So if, they did 254, then they would pay for 254. If they did 200, they would have to pay for 205. But that's really what it should have been. What it really was broken down is because it was a contract that had been negotiated, and there was different hospitals that were brought on board over the course of the next, over a course of 6 or 7 years, that there was different agreements. So each of the hospitals actually had their own monthly minimum. So this is something that we would always recommend. If you have this agreement or a similar type of agreement, and there's monthly minimums that is broken out, especially for a health system, you want to go back and make sure that the monthly minimums are, how are they tied into each of the facilities. And you can see here, this facility, Hospital A, was at $33 a month, and the minimum was $15. This one was doing $14 a month. The minimum was $20. So obviously that's a problem because that's why they had a minimum shortfall over the annual. They had 69. So this hospital paid 69 for 69 cases that they didn't even use. This hospital had cases per month was 80. They had a minimum of 70, but there was a few months where they dropped below. So there was a couple months they had 65 or 64. So over the course of the year, they paid for 18 extra cases than they should have, right? This hospital had just under 29, this had just under 74, but look, their minimums were 15 and 45. Now this was the real problem area. So this was the hospital, one of the smaller ones in the health system, actually the second smallest, I believe. They had a monthly minimum of 40, and they're averaging under 24. So they were paying 198. They paid 198 cases per year, and that was significantly higher. So, if you don't go back to the invoices you're looking at it, we're negotiating and saying, all right, well, the 254 cases, minimum 205 is not too bad, and we were able to negotiate it to 175, not to mention the pricing, but just from the monthly minimum, because this is kind of the one important part of why we wanted to bring it up. But we also were able to say, you know what, for the whole system, they should be at 175. So instead of having these all for individual line items, they're going to have it for the 175. So that's very important. So, that was a...
Yeah, so I just want to reiterate that, again, we're going to talk a lot about the line item details being so important. And so knowing that individual hospitals had the individual line item spend, looking at the contract, and being able to understand the specificity allowed us to have the insights and go back and look at utilization. If this contract, had been able to be reconciled every month, then it would have been flagged. And it wasn't, and it's just because of the complexity of it, but we're going to get to showing you how Invoice ROI works and identifies in real time purchase services, contracting to monthly invoices.
And just to give you in context what this means, this was about $70,000 a year they were spending on cases that they weren't using. So just a form of reference. All right, so the next one we want to show is so now this is the denial management. This is a revenue cycle. And it's interesting, they had, we had the contract, we were getting the invoices, and what we look at is now this is the cost structure, so the compensation for this third party. So anything that from a placement amount, right? So with anything above 1,000, less than 90 days is at a 7%. Anything above 1,000, greater than 90 days, so greater than 90 days from discharge, is 12%. Anything regardless, so anything below $1,000 or $509 to $1,000 was 17%, and then this is supposed to be for legal was 25%. So
just want to give everyone just a little bit of context. Like Rich said, this is debt collections. Usually a hospital has several providers of debt collections. And there's a lot of, as I said earlier, a lot of specialization and nuances into these agreements, and how they're used is really important. So I think, Rich is going to explain why this was another red flag because of how the hospital was using this particular agreement.
Right. So again, we asked for the invoices, and they had a couple of different accounts with this specific provider. And again, we blocked off all the names. Hopefully they can't see them. And what we kept coming back to is the reports that they were sending us didn't have any of these percentages. So didn't have the 7, didn't have the 12, but everything was coming through at 17%, which was very strange because we were seeing things that were placed, above 1,000 and below 500, and everything was being at 17%. So then we went back to the company and we asked the question, why is this happening? And they said, well, because the placement amount was at 0. So the way that the system was set up at the hospital, it was coming through as a 0 because it was 0 placement, because it was a denial.
A 0 balance.
A 0 balance. So therefore, this company was defaulting to the 17% because that was the highest percentage. So we went back to the hospital. We got the original reports that were sent through to determine if where they were they should have been, and it was, $1,000. If it was above $1,000, where was it? If it was plus or minus days, we had all that information.
It just makes sense to us that everything was falling at 17%. So it's not something we normally see. So
right. So the assigned amount was really where the number was. So instead of having the placement amount, it should have been the assigned amount. So when we went back to the company, we got it all fixed. We had these invoices. So the company had collected $2.9 million over that 12-month period. The total fees in that period were $494,000, again, based on the 17%. And what we were able to do is adjust the system with the hospital to be able to reflect what should have been the rates and reduce their pricing by almost $230,000. Again, going to the invoices, matching it with contracts, making sure what's happening. And then it took us a couple of months because we had to help the hospital manually for a couple of months before they were able to set up their electronic system to be able to do this. But again, it's just a matter of trying to find, and match back up to the contracts.
And so in this case, that $230,000 savings, it was A, missed, and B, it took a tremendous amount of time and resources to get it fixed. Now it's fixed. Now the hospital is reconciling every month. So they have the line item details. We're going to show you some of the reports in other categories in a moment.
So this is another one, and if anyone works in telecommunication and has ever tried to review invoices, this is actually a CSR, but it's as you can see, there's 740 pages. This is actually page 740, so it actually goes higher than that. But there's a fee that we wanted to highlight here, right here. So there's 69 of these PRI B channels, which are at $5 each. So, and again, we're doing our review, comparing, extracting, and then analyzing month to month. This is January.
And I want to mention that this kind of analysis, not only is it painstakingly almost impossible, like we said earlier, but it requires specialization. And we have one person that is highly specialized in telecommunications and is able to identify these things immediately, and she did. And now the hospital has got the capability of doing this with the push of a button.
Right. Right, so that was January. This is February. Now you can see in February, for some reason, and for me, I always ask these questions, how does this happen? And no one can ever really give me a good answer. But those 69 PRI-B channels now split into 3. 2 of them are being charged the same $5 price, and now one of them is being charged, or 23 of them are charged $208 each. So now this is at $47.84. Okay? So now we're moving to March. Now they're all back to 69, but now they're all being charged to $208. And then you look at April, again the same thing, and then May. So it was around this time that we identified, or our team identified this as the issue. And just so give you an idea of what that is annually, when we were able to fix it, it's about $180,000 annually. These charges increased. So we picked it up in month 4. A lot of times this is something that could be missed until 12, 18,
or never found
Never.
Because the volume, as based on the this client, is in that like 10% range of maybe this looks okay, and that may not have been identified actually.
Right.
And if you think about it, whether it's 15,000, 230,000, 180,000. Think of all of those, those costs that just go out the door unnecessarily, and how hard a hospital's got to work for to generate revenue on a 2 or 3% operating margin. And this is just money that can be found, and needs to be found in kind of an easy way for hospitals.
All right, go to the next example here.
We want to get to some of the analytics. I think we've got a couple more before we get to the analytics.
This is okay. So this is a big growing area for a lot of our clients, which is agency staffing. As you can see, we want to just give you an example of an invoice Some of you have seen it, some of you probably haven't seen it. But you can see here, this is the, the date range, the shifts, the regular hours, overtime, rate, and then, comments, on-call, callback. And it's typically 2 pages, sometimes 3 pages. There's some more backup. So we had a client that was wanted to do an RFP, and they wanted to do an RFP really quickly. And they brought us in, and they, this was at the end of August, and essentially said, we want to send the RFP out and get this done, by the end of September, and this was right before the Labor Day weekend. So, this is a significant spend. So what they did was they gave us 1 month worth of invoices. And again, some of them were 1, some of them are 2, some of them are 3 pages. There was 284 invoices. So what we were able to do, when we extract all of this is all done, within 24 hours, we were able to extract the line item, and we're looking at 3,327 line items. And you can see all the different costs in here, and then the different base rate, callback, on-call, and be able to provide from location, each location, specialist, what type of, some of the regular hours for the month, right? The overtime rate, the rates, the gross rate, all of the things that you would want to put in as far as understanding your cost structure. Because again, you go out to an RFP, you get pricing, you don't know if your pricing is good, you don't know where the leaks are or where the holes are, and you can see that even, within some of the different specialists, there's different price rates, depending on the callback from $90, $87. So we put all this together, within 24 hours because it was, we really need this, help us. Here's the invoices, and again, it was 284 invoices with 3,327 line items.
Within 24 hours, turned it around and gave it back to our client, and they were shocked. They could not believe that they had access to this data so quickly. So we have clients that ask us to do this for them for their initiatives, and we have clients that say, listen, we want you to do it and do the analytics and measure and monitor over every month. And again, we're going to show you some data analytics in a moment. But that's the power of being able to take that trapped data and invoices, digitally extract it, and have it available for analytics.
All right. So I'm going to go to one other one now. And let me just pull it up. Sorry. So we had another client, and this was an initiative that they were going through. They wanted to review their time and material, biomedical expenses for a period of, I believe it was 2 years. I have the invoices up next. This was similar. There was 264 invoices. This was totaling almost $7 million in spend. And we have the extraction here, and this one is, let's see, line items. So there's 7,495 line items for these invoices from all different locations. You can see the date range here, total amount, the PO, the case, the charges, all the information pulled from, again, when we look at the it's hard to read, and that's part of the issue with some of these purchase service agreements is that, these are, let me see if I can move this up a little higher. All right, so this is the parts, the rate, right, the total, this is the quantity. I mean, to put this into, and manually input this, is very challenging. And here's just, the description, charges. That's why it's so important to go back to line item details, because you can see this is all the information that you need, and it's really difficult. I mean, this is 6 pages here.
Just one invoice is 6 pages, and it's impossible to get the data that you need extracted, and you have to go back to your paid invoices, because so many times, even if you were to ask for utilization reports, you do not get the utilization reports like you would on the paid invoice data.
Right.
And so what was really interesting about this analysis, because we only have about 15 more minutes, we want to jump to some of the analytics. What's interesting about what we were able to do, we found that an extraordinary amount, 82.8% of the damages were physical damages. So the repairs were physical damages. And as everybody knows on the call, physical damages is an exclusion on a covered maintenance agreement. So what we were able to pop right out is that there's a huge problem, right? Is this really just being defaulted to physical damage, or is this actual user damage? In our experience, 83% is not actual user damage.
Yeah, and I think one of the other things that were identified in the data, and again, extracting it out, there were certain types of beds, electrical beds together, the two companies together. One had more parts to repair and was more frequently being repaired. So they were in the process of evaluating for a capital purchase, and even though this had been from a year or 2 years ago, we were able to pull that information into there, and they were able to use that information to say, wait, hold on a second, let's bring this into our decision making, because X company might be giving us a better deal because they have other service areas supporting the hospital, but their beds break down more often, and when they do break down, it costs more for us.
So not only they were able to see that to compare the bed cost, the parts took more parts to repair that bed company, and it took more time. So we were able to go down to such specificity of cost, time, parts, that it enabled them to make some really important decisions, like Rich said, in terms of capital, as they went to move forward. Now we're going to jump to some of our analysis in ROI.
Right. So we are working with one client in evaluating their the pathology reference testing, and I just want to this is the new system that we're working with, and what we wanted to do, what we did was there was invoices that we pulled together from August 31st of 16 through the end of September of 2017.
So what's interesting about this agreement is this agreement was based on Medicare rates. So every year, well, first of all, we had to map into our contract engine the Medicare rates by year, and then pull in the invoice data to be able to reconcile, and Rich will go into the findings.
Right. So the total spend, again, from this time period, we see that there were $24,000 in overcharges based on the 2017 Medicare rate. And what we did was we pulled in what the current price is to Medicare. And in this little green spot right here there were 4 tests that were accurately reflecting the 2017 Medicare rate. This bucket here actually was still reflecting the 2015 Medicare rate, which means that they were undercharging by $752. But when we went to these two, one there was not set up originally, and the other it was set up but had the incorrect pricing. Both of these were not reflecting the 2017 Medicare rate. When you add those two together, it was $24,000. So you can see one's $12,800, the other one's $12,250. So, and then we have to minus the $752. So in total, this company was not charging the correct rate, and we wouldn't be able to see that after, again, 2 years. And you can see that the line items, there's 18,000 line items that were extracted. Each of the line items is in this report. We're able to pull out and run different types of analysis off of it. And it's funny, there was one test that we could not match to the Medicare rate. It was no longer existed. It had changed. So out of the entire spend, only $16 was not matched.
And this is the power of purchase services line item analytics. I mean, not only did this result in a credit, but also a savings go forward. And then we don't have time to show you all this because we want to show some more examples, but you're also able to look at utilization, right? Top 10 test spend and kind of drill into, what is the 85025 test and really start to ask some more strategic questions. Now, purchasing, now departments can be really strategic in their analysis and they don't have to be tactile in their approaches.
Another example we have here is with medical gases. Again, what we did was we put all the line item details into, pulled it into the report, into the analysis. We're showing the bulk gas to cylinder rental, and where all the costs were by location, and then where the bulk and cylinder, where all the different cost aspects were. And showing what was on and off contract. You can see all the different tools that are in here, and the ability, from a medical gases, if you ever audited or reviewed medical gas invoices, is very challenging. So to be able to get all this information into one user-friendly, extract the information off the invoices and put it into user ability to make decisions and really kind of talk from a, again, from a strategic standpoint versus a tactical standpoint. And then the last thing we want to do, I'm sorry.
And another benefit looking at medical gases is ongoingly, on a month-to-month basis, managing these invoices on the invoice levels. You can keep track of containers in, containers out, cylinders in, cylinders out. So you're not solely reliant on the vendor to know what's missing or what they're holding you accountable for in terms of their inventory that you're renting from them.
It's a great point. And we don't have this up. We don't have enough time to show you all of this, but Brian did this analysis, and we funneled in the cylinders in and out and matched it to the agreement. And the agreement, they were being charged a flat fee on the invoices, but Brian was able to program in the agreement into the contract engine, and it was interesting because. Go ahead, what did you find?
It was actually about a $10,000 per month overcharge, where they're paying a flat fee at $19,000, but had they just stuck with their a la carte contract rates, they would have been closer to $9,000 a month.
Right, so a huge find again, and the only reason that was possible was because those line item details were extracted and analyzed against the contract.
Sure. And then the last slide we're going to show here moves over to PPI, but it's actually an orthopedic review. And again, the Power BI platform allows us to have some great visuals. And these visuals all on the same page have established relationships and interact with each other. So here's where we have a savings opportunity of $400,000 from a benchmarking point of view on a spend of $2.3 million. Again, all this data is given to us raw, and then it gets extracted, cleaned, and labeled, and then at the end, the intelligence aspect is put into it. But all of these charts will interact. So on the bottom right, we can see our monthly trends. We could draw up the quarterly trends by any category that's shown here. And again, our savings is going to change, and our pie chart on the top. So we could drill down or drill up to any of these records. So
Brian's going to keep on going,
yep.
But I want to jump in for two reasons. One is that we have given this data to our clients and for their performance reviews or for negotiations, and actually had the vendors say, how did you get all this data like this? I mean, the vendors themselves have been shocked. And then the other aspect, which is really important, is for rebates. And I can't tell you how many times that hospitals aren't getting their rebates because they don't have this ability to pull their own data. And nowadays, where so many things, the contracts are interdependent on one another, it's so important to be able to pull this in to say, actually, I am due my rebate. I can tell you how much you actually owe us for the rebate.
So this becomes a powerful tool because we can see an instant in real time. We can see trending by categories. On the left here, we have all of our POs. So you can see PO amounts going down, and you can get an idea of what your most commonly used constructs are, and we could drill down. And again, all of this data becomes exportable to CSV, so it can be used to generate these spreadsheets to send out externally and to the group.
Yeah, and we love trending line item details, right? And you get so much insight into, maybe where there's a new product being used. We'll see, Brian and Rich have always say, listen, they're using a polyliner now, or they're using something, that they haven't used before. You get to see it in real time and not have, 20 months of a new, very expensive liner. And she's going to show you this now.
So you can see that in real time. So when we drill down on our total hits, we could see our constructs. So we can see that there's a large spend in ceramic heads, which is a premium upgrade. We can see that there's a large savings opportunity in our month-by-month spend, or our vitamin E enhanced liners. And again, all this data is just going to interact and become exportable to a CSV.
Right. So that is it for our demonstration. So we wanted to kind of keep it to an hour. And what I'd like to do, for those who are interested, you can, email myself, Brian, or Rich. We would love to do an example for you, a proof of concept. If you've got an area where you'd like us to get a few months of invoices and do this analysis, we'll do it for everybody, one at no charge. So email us. We'll show you what we can do, and we'll have a follow-up for everybody on the webinar. And just want to thank everyone for their time. And hope that you got a lot of value out of it. And again, we can't stress enough that the purchase services line item details are so important. That category spend is directional, but no matter what you do, you've got to understand your spend. You've got to get to that line item detail in order to really drive significant savings. So please contact us if you'd like to learn more, and we'll look forward to speaking with everybody. Thank you.